From the patient's perspective, a medical home is acting as the quarterback of their care. The medical home is able to take all of the necessary care elements and bring them into the huddle and make sure that each team member knows what needs to be done for a patient to ensure that they have the right care at the right time and for the right reasons. If we look at an example of a patient experience to kind of show some of the aspects of a medical home, we'll talk about Mary, who is 62 years old, has diabetes, and is 30 pounds overweight. When Mary doesn't feel well, she can call her medical home and she can receive an appointment that day. Once her care team knows that she's coming in, they will plan for her visit. Her care team includes Joan, her medical assistant, Sue, her case manager, and her physician, Dr. Smith. Joan will look up Mary's information in the electronic medical record and will verify that any tests that may have been ordered on a previous visit were completed and are documented in the system. Joan also notices that Mary is overdue for a preventive screening test and makes a note to remind Mary that she's due for a mammogram. When Mary comes into the office and Joan begins her care, she completes a foot exam for Mary. And while she's doing that, Mary mentions that she hasn't been taking her blood sugar as often as she should. Joan knows that taking her blood sugar is part of Mary's self-care plan. And so Joan talks with Sue about making arrangements for Mary to meet with Sue while she's at the office to discuss her care plan and offer support and education that Mary might need. By the time Dr. Smith comes in to see Mary, he can see all of the information and the care that Joan and Sue have provided by the documentation in the electronic medical record, and he can fully address all of Mary's health care needs while she's at the office. When Mary leaves the office for the day, she's given a report card which shows her progress towards her goals and also gives her all of the information she needs to complete her self-care at home.